The first test for the shoulder is O'Brien's. It tests for slap lesions, AC lesions, so overall the labral tears. The patient sits or stands. Their arm is in a 90-degree shoulder flexion with their hand pronated or facing down. The examiner stands off to the affected side and assists with this special test. This is performed by the athlete applying an upward force to the examiner's hand and slowly supinates it or rotates outward or palm up. A positive test is reproducing pain and or popping or clicking inside of the shoulder. So with that one.
Okay.
So out, rotate while I push down.
Rotate it this way?
Yep.
Yeah.
The second shoulder is Gerber liftoff. This test for subscapularis tear or dysfunction or tendinitis of the subscap. The patient is either positioned on their stomach, sitting, or standing. In this case, we'll do standing. The examiner is positioned on the affected or injured side. This is performed by asking the athlete to place their hand behind their back with the back of their hand on their back. Perfect. The athlete will then raise their hand off of their back and is asked to hold that position. The examiner then will push the hand inward or towards the back while the patient holds that position and tries to not let the hand touch their back again.
Like that?
Yep.
And then I push against your hand?
Yep. A positive test would be if the patient is unable to move their hand away from their back or weakness in doing so. Another would be if pain is reported. Good job. Then we go to elbow. The first test will be the valgus test, which it'll test for damage of the UCL. The patient is either sitting or standing with their arm slightly flexed at the elbow. The examiner will be positioned facing the athlete. This is performed by the examiner gripping right above the patient's elbow with their outside hand and gripping the athlete's forearm with their inside hand. The examiner will then push in on the forearm and pull out on push in on the forearm or the bicep, pull out on the forearm. So then, relax. That's not relaxed, is it? There we go. Good. A positive test would be reproducing pain or no firm endpoint is palpated. The second elbow test is the Tinel sign, which will test for the ulnar nerve irritation. The patient is positioned either sitting or standing with their elbow slightly bent. The examiner is positioned in front of the patient. This is performed by percussive tapping on the UCL in between the olecranon process and the medial epicondyle. A positive test would be tingling occurring in the forearm. So, bend a little bit. Okay. Right here.
Tickles.
Oh, okay. Okay. The first
Like that.
The first test for the cervical spine is the Adson's test. You can stand up. It is a provocative test for TOS or thoracic outlet syndrome, accompanied by compression of the subclavian artery. The patient is sitting or standing with their arm in full extension. The examiner is positioned behind the athlete and slightly to the side of the affected arm. This is performed by the examiner, palpating the radial pulse while the arm is extended to the side below the waist. Step forward just a little bit. There you go. Palpate, back. Now turn your head towards me. Yeah, there you go. Now inhale and hold your breath. test would be marked decrease or disappearance of the radial pulse. And then you would compare it bilaterally to see what that normal pulse would feel like. Next cervical spine test is the Sperling test. You can sit down. It'll test for nerve root compression. The patient is positioned seated, and the examiner is behind the athlete with their hands on the top of the patient's head. The patient will slightly extend their head back and then tilt it sideways, and then the examiner will push down on the crown of the patient's head and carefully compress downwards. Up from behind you again.
Okay. Shoot it.
Okay, so come back. Now to the side. Now hold it. Now I'm gonna push down. Good job. A positive test would be radiating pain or another neurological sign in the arm of that same side, or pain in the neck and the shoulder. The head special test, the first one is the TMJ loading, and it tests whether you have a healthy joint or an unhealthy joint. The patient is positioned sitting. The examiner is positioned in front of the patient. This may be performed by biting down on a popsicle stick, but we don't have a popsicle stick, so we're using a clothespin. They will slide their jaw all the way forward and then all the way back as far as they can go, or they will be instructed to chew on cotton as opposed to a forceful bite if it is bad. So, yep, and then go all the way forward and then all the way back. Good. You can take it out now. You make sure it's even on both sides. A positive test would be reporting of pain on the involved side, when it can be an anteriorly dislocated disc as well. The second head special test is the halo sign test, which determines whether or not there is a cerebral spinal fluid in blood from a head wound. The patient is positioned sitting down. The examiner is on the side of the affected ear, and this is performed by a clean piece of white gauze placed up to the ear, and then you let the head tilt so that the CSF can go onto the gauze to be tested. So, pretending this napkin is white gauze. Okay, tilt my way. Okay, oh no. Cerebral spinal fluid. A positive test would be cerebral spinal fluid on the white gauze. Okay, next is the forearm, wrist, hand special tests. The first one is the Phelan's test. It is a provocative test used in the diagnosis of carpal tunnel syndrome. The patient is positioned sitting or standing. The examiner is positioned in front of the athlete, and this is performed by the athlete doing a reverse prayer. The back of their hands are touching and pressing together, and they'll hold for 30 to 60 seconds. She can't do it. She got surgery. I'll show it. It's like this. A positive test would be reproduced symptoms and carpal tunnel syndrome symptoms. Next is Finkelstein's test, which tests for de Quervain's tendinitis. The patient is positioned sitting or standing. The examiner is in the front of the athlete. This is performed by the patient making a fist around the thumb and then doing an ulnar deviation. So, yep, and I go. Okay, good. A positive test is if the patient complains of pain over the first extensor compartment of the wrist. And then the first test for the thoracic spine is anterior posterior rib compression. Test for rib fracture or contusion. The patient is positioned sitting or standing. Stand up, please. The examiner stands on the side of the patient with hands on the anterior and posterior aspects of the rib cage. This is performed by the examiner pushing the hands together on the sternum and in between the shoulder blades to compress the rib cage and then release the pressure. Just stay normal.
Sorry, I didn't know if you were going.
Good. A positive would be pain with compression or release of pressure. You can sit down again.
Okay.
The second test for the thoracic spine is the slump test. This tests for neural tension and detects altered neural dynamics or neural tissue sensitivity. The patient is positioned sitting on the edge of the table. The examiner is positioned in front of the athlete. This is performed by the athlete sitting at the end of the table. They slump forward, and if that doesn't cause any pain, then they flex, they kick out their leg. Okay. So, tuck your chin, but slump a little bit. There you go. Does that cause any pain? Okay, raise one of your legs. Does that cause any pain?
No.
Does that cause pain?
No.
Okay, good.
Let's take that out of the ordinary.
A positive test would be reproduction of pain as tension is applied. If extending the knee causes pain, then you would have the patient extend the neck into neutral. And then if the patient is still unable to extend the knee due to pain, then it is positive. And